In other news tonight, leaders from several federally funded organizations in Tuscaloosa coming together for Congresswoman Terri Sewell's Congress in Your Community tour. Now, Sewell says her goal is simple: keep you informed on what's happening in Washington and how proposed federal cuts could affect you.
Your reporter James Giles joining us now after having attended the roundtable. And James, what do those leaders say is at risk?
Steve, Brittany, jobs at the VA, hospital, nearly all funding for the Maud Watley Community Health Center, and programs like Medicare, Medicaid, and Head Start. That's all according to Congresswoman Terri Sewell and other leaders from tonight's forum. A packed house at the McDonald Hughes Community Center, standing room only, as Sewell brought her tour to Tuscaloosa. She says events like this are crucial to keeping her constituents informed about what's happening in Washington and how it could impact them. While there is still a lot of unknowns concerning federal grants and loans right now, the Trump administration has made it clear they are cutting back on federal spending and weeding out what they call waste. But for leaders at the Maud Watley Community Health Center, any proposed federal cuts could threaten the future of one of West Alabama's only healthcare facilities.
We serviced over 60,000 people who came in and out of our doors. So we see a lot of people. We depend on federal funding. 100% of our staff salary is federally funded.
$800 billion cut from Medicaid in a state that didn't expand Medicaid like Alabama is a gut punch to the very vulnerable in our society.
Sewell says Medicaid plays a major role in our state, covering half of all births and 45% of the state's children. She also visited the Tuscaloosa VA hospital today, where workers fear for their jobs after about 1,000 VA employees, many of them veterans, were recently fired.